Hi, everybody. My name is Dana. I work with Axonics. I'm a clinical specialist. I'm a nurse by training. Um, Sacral neuromodulation is, if you think about it, it's like a pacemaker for your bladder and your bowel. So it works for both. So it works for frequency and urgency. And it also, retention, if you have a hard time starting your urine or you can't, it also will work on helping if you have fecal incontinence. How it works is there's signals down in your tailbone underneath there. There's nerves there that run up to the part of the brain that goes back down and helps and goes back down to the bladder and bowel to kind of make that connection again. Because there's some kind of disconnection they've found when all of a sudden you're peeing every 2 hours or every hour, or you start having bowel accidents, or you have to sit down and you can't pee, but you feel like you have to pee, and then it takes a little bit of time. So the thing is when we stimulate that nerve down here, it makes a connection with the brain that goes back down to the bladder and bowel. And kind of, it's not a cure, but it kind of like brings it back together, makes that connection that you can have a better quality of life. It helps people get off of catheters. It helps people get out of wearing Depends. But it's not a cure. So we have a trial that we do. Everybody can test it out, and there's not too many things in healthcare you can test out before you get it. The trial consists of you have two little leads put down in your natural opening in your sacrum. It's connected to an exterior box, and it provides stimulation down here. After a couple days, we have you keep track of your symptoms. We'll see if it helps or not. And you kind of know right away if it's going to help you or not. That's the least invasive trial. Then we have another one that you can try it out for a little bit longer if you didn't have a good trial with the basic one. It is it works very well when it works, but that's why we do the testing. Does anybody have any questions? That's the simplest way.
How does that with the spinal cord injury?
Well, yes, it's not it's off label for neurogenic bladders. So I want to put that right out here with the group that I'm talking to. But you can go and see the doctor, and they can see if you're a candidate. You can try the trial. Maybe it will help you. Maybe it won't.
What about nerve pain? Because some of us have huge amounts of nerve pain in our sacral area and our bottom and all in there. When you have a stimulator like that, does it cause a signal so the point like so you can feel it?
It's not for for pain in your
No,
back.
no, 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 no. I'm not asking about like
Okay.
if it's for pain. I'm asking, does it cause any kind of like feeling or pain in the sacral area?
If it's too strong, it can. If we have it in the wrong nerve, it can. So we test it out when you're getting it put in. We do a lot of tests on motor functions, and we also ask the patient where they're feeling it. And we use fluoro so we can see if we're putting it in the correct place. So we check it um, by sensation, by motor function, and also on fluoro. We have it in the right place. That's when we place the temporary leads, and with the permanent one too.
Okay. Has anybody that you've done it with has neuropathic pain down in that area? Do you know?
I don't remember. And I tried to look up things that if we had anything in our literature about it, and I couldn't find anything. I know I have worked with patients. I just can't recall.
Okay.
It has a lot of great, like off-label things that it has helped patients with pain that we weren't doing it for pain, but they said I used to have a pain in my bladder, and that it went away for that when they had this test and when they had the implant. The technology's been around for a long time. Go ahead. I'm sorry, Stryker.
Is there a range of getting used to it for it to be more productive, or should it be immediate that you have this functionality?
If it's placed correctly the first time with the basic trial, you should see results right away if it's going to work. You see it in the first 24 to 48 hours because those little leads, they're not attached to anything and they'll migrate out easily. So we look at if you're feeling it in the right place and it's not working, it's not for you. If you're not feeling it, maybe you didn't have a good test. You know, maybe they got away from the nerve faster. But most people see it right away if it's going to help them. Now, retention's a little bit longer. They say it's 2.6 days to see any results. That's the average with retention if you're unable to start a stream or to keep a stream. So it takes a little bit longer, but the overactive bladder and the urgency you see right away.
Okay, so let me understand this. If I put these leads on my bowel, in the morning I can just hit a button and I'll poop.
No, it doesn't work like that. And a lot of people do think that's how it works. What it's doing is it's putting stimulation on the nerves down in your sacral area that go up to the part of the brain that go back down to the bladder and bowel. So remember when you were 10 and you had to go to the bathroom, but there wasn't a bathroom for you, your mom's not going to stop. You could hold it and you had control over it. You knew when you had to go. There's a disconnect that happens where people lose that control and they feel like that connection goes from the brain and the nerves in the sacral area. There's some kind of disconnect. So it's not going, they're not receiving that signal from the sacral area up to the brain to go back down to the bladder. So we found that like a pacemaker, like I said earlier, when we put some stimulation on that, and you have a remote control because during the trial, we want you to feel a tapping, tingling, or vibration. So it's not something you're going to turn on and then you go poop. It's kind of keeping the stimulation. Let's keep the stimulation up to wake up that nerve. Wake up, wake up, wake up. Does that make sense? And a lot of people think they're just going to push a button, it'll work.
So I think to clarify, is it if you are becoming a candidate for it and then it's placed, is it always on?
Yes.
When it's okay. So it's not like I'm about ready to do my bowel program. I'm going to turn it on to help me do it. It's once it's implanted, it's like an always on kind of thing.
Yes. Yes.
Okay.
So will it feel like I have to go to the bathroom again?
That's why we do the test. Yes. Yes. If you have retention and you can't, we want to see that you can start a stream and, empty your bladder by yourself.
But do you basically need to have bowel and bladder function, like control, if you will, in order for this to?
No, well, we do it for people that don't have control. So this is to restore it. And if we look for 50%, so that's what our goal is. If we can get 50% of a reduction in one of your symptoms, we know that the therapy will work for you. And you could possibly, have good results with it. But most people have a little bit better. But 50 is our goal that we set with people. We don't want you to think it's going to help you. It's going to make everything, the same back when you were, 20 or 15.
Okay. I'm not understanding.
Yeah, I'm confused as well, James.
Okay.
Because I think, James, you calf?
I have a Foley.
Okay, me as well. So I'm a quad. I have a colostomy. So, obviously that's not going to work for me. But I used to do a bowel program, and I used to calf. So would that have been any, no voluntary control whatsoever? So how would this benefit someone like me, if at all? I guess I'm having trouble grasping that.
Well, we would want to see during the trial that it would help you be able to start a stream on your own and empty your bladder more completely. That's what we look for.
But if I have to calf, like I have a neurogenic bladder, right. So you're saying that wouldn't. I guess that's where the disconnect is for me.
Yeah, it's off label for neurogenic bladders, but if you're a candidate, I would encourage you to go see the urologist at Penn State and see if you are a candidate for they do a workup with you, to see if you're a candidate for the trial or the therapy.
Okay, what about bowel? The same way?
Same way, yeah. So if you can't control your bowels, and we say that's from like if you can't hold it when you have to go to have a bowel movement, or you just
I
have
don't
a
have any
clearing.
feeling down there
Right, so it just comes out. So,
whenever it comes.
so we would hope, a goal would be during the trial that you could feel it when you're gonna have a bowel movement and that you could control it and get to the toilet.
They wouldn't be able to do that just because of the nature of the injury, because they would not,
Yeah.
you don't have the sensation. But my understanding, and I haven't listened to all of this, so I don't know. But my understanding is that this may be more for an incomplete injury than for a complete injury.
Correct.
So if you have a complete injury, if you're in Asia A, this may not be of benefit because there's the ability to regain that sensation is not possible.
Right, so it's not for neurogenic bladders, but for not, complete injuries, you'd be a candidate for it.
Do you have any pictures or films or,
I gotta run.
I'm sorry, what?
Yeah, we were expecting more of a slideshow.
Oh,
Sorry.
I'm sorry. I should have got one for you. I know I should have. I can come back on with a video. I can send some pamphlets out to you. I don't know if you guys ever meet all together, or I could do you have a contact person? I can give you, we have information about it, like just trifolds with it.
Yeah, I would say Nancy is probably our primary contact person, but I could also serve as a contact as well via email. I'm a therapist over at the hospital.
Okay.
And maybe if we still feel like we want a little bit more discussion on it, we could always do maybe like another revisit.
Yeah.
And do like another kind of talk about it at like a later support group time. So I'll shoot you my email in the chat so that you can get in contact with me for some materials as well.
We also have, everybody have a smartphone now? Probably. We have an app you can put on your phone. It's free. It's called My Axonics. It has YouTube videos about the therapy. It has some literature about it, how the therapy works. And it's very, very, very informative. And I would go there first. If you guys, it's free. It's an app. You just go on the information. It has a lot of good information. I think it would maybe clear up what.
My app.
Yeah. So I do want you to know that one of our members does have one, and it has assisted her with a spinal cord injury, and it has assisted her with bladder management and bladder control.
I'm glad to hear that. Yes.
So, and that's why we thought, well, hey, we'll bring, because I don't know anything about them, and there's information, like, but you just had your thing done, and that's been tremendous.
No, I've got to ask a question to this young lady.
You go right ahead.
Actually, a couple questions. Did you say that somebody with a neurogenic bowel and bladder, this stuff wouldn't work?
It's not, it's off label for it. So
with that said,
then I'm a little bit confused. Who's it for?
Butch, hold on. With that said, one of our patients with a spinal cord injury does have it. She is an incomplete injury, and it has helped her. So it's kind of like using a medication that's not necessarily for something, but the side effects of that medication will help, say, the pain type deal. Like Cymbalta. Cymbalta is more for like depression and mood, but it can help with pain paired with another, but that's like an off-label use of it. So this would be like an off-label use to assist. And it I don't know, it may not be for a large a large number of you guys, but it's worth knowing about to find out if potentially it might be of use for you.
Is there a stimulator inserted into your back if you are qualified to get one?
It's in your butt. So it's above where you sit and below where your belt would be. So right in that area.
There's a stimulator inserted.
Yes, if you're a candidate.
And then
Yep.
is there also a battery inserted at the same time?
There's a lead that goes in the natural opening in your sacrum down in your tailbone attached to the battery, all under the skin.
Okay, and then you have a remote control that whomever has the device, Boston Scientific or whoever it is, they program the remote.
We
correct?
program the battery. So the remote can connect with the battery and then you can make changes, maybe increase the stimulation, decrease the stimulation. There's 2 programs on the battery. You can change your program. So there's a lot of things.
For somebody that already has, like me, I have a spinal cord stimulator. Okay.
Mhm.
Then that wouldn't be a good procedure for me to go through to have another stimulator inserted in my, I gotta be doctorally correct, my buttocks. See, I didn't say ass, Nancy.
As long as the device is 6 inches away from your other device, you can have it implanted. So if your back stimulator is on the left, we can put it on the right as long as it's 6 inches away.
Well, the back stimulator is on my spine.
Yes.
The battery is down on my right side. My right actually would be just above my right buttocks.
Right.
So it would have to be done on the other side if I was a candidate.
Correct.
So let me tell you guys, when I was at the ASCIP conference, the sacral nerve stimulators are utilized to assist. And I do believe they do. I'm not well versed enough to really talk.
I think you're doing fine, Nancy.
What's the name of the app that we go into play and look for? What app are we looking for?
It's called all lowercase my.axonics.
How do you spell Asonic or?
So it's AXONICS.
Okay.
And it looks like, maybe I can show you on my phone.
I've also put it in the chat for you guys if you can.
Thank you.
Typed it out.
Thank you.
Just being a good secretary this week.
You rock.
Yeah, so it kind of looks like that. And then it has a lot of, learn about the therapy, tells you what to expect and how it works. I think you guys will get a lot of benefit out of just watching this. I really like it.
And 2, you do a trial to make sure that it's something that's going to work, correct?
Absolutely. Everybody gets a trial and they have to have at least a 50% improvement in one of their symptoms to go forward. So we do a trial on everybody. We don't just implant people thinking maybe it'll work or maybe it won't. So
But you have a question?
Oh, sorry.
No, it's okay.
Is there any impact on sex for men?
No impact at all. You can have sex. Not during the trial though. And you're not even allowed to bathe during the trial. So yeah.
So question with that. You can still have sex. So with the spinal cord injury population, I know they have stimulators that they use that's for bowel, bladder, and sexual function, like erections.
Okay.
I don't know what it's called or if this is it or not. But basically the what I little that I know is that you have like a remote then that there's a button for bowel, there's a button for bladder, and a button for sexual function. That's not this, correct?
Correct.
Okay.
It just turns up stimulation or turns down stimulation.
Okay.
Not-
Kind of
not-
like a TENS unit.
Yeah, at a
Okay.
lower level. Yeah.
Right. Okay. I'll be back.
Okay. Yeah, there's a 5-day trial.
And you can't take a shower during that then, you were saying?
During the trial, you can't take a shower. We want you to limit your activities, bending, twisting, lifting.
Okay.
Yeah. So be real careful because these little leads that the doctor places, or the nurse practitioner, they're not anchored to anything during this trial. It's just a simple it's a nerve evaluation. So they're just testing the nerve. If it stimulates if we stimulate that nerve, is it helping your bowel or your bladder at all? And at least 50%. So that's what it's doing. It's just putting a gentle stimulation on that nerve.
Does it have,
Oh, go ahead, Bill.
was there anything that would, during the trials came up about AD, autonomic dysreflexia, or the support that it has for that, or if we have too much retention, that we go into autonomic dysreflexia, some of us.
Okay.
Yeah, I didn't know if any of that came up during your research at all, or
During the trial, if you have an indwelling catheter, they will remove it, and then or if you cath. So we want you to cath during this too. We want you to try to pee on your own, but if you can't, we want you to cath because we don't want you to go into any kind of syndrome like that. And the indwelling comes out. If you can't pee, we usually have you cath 2 times a day and keep it measured. You don't have to count the peeing out, but we do like you to keep the volume of what you have to still have in there. That's important. So we want to see that proportion peeing out more and that volume of your cath go down.
Okay.
I said that was going to be my question for the people that are on the side of retention rather than overactive type of bladder. Is there a point where you say, hey, we have to cath for safety to make sure that we're not retaining too much if that sensation and that motor isn't coming back?
Yeah, so it's usually 2 or 3 times a day. So when you wake up in the morning and before you go to bed, and sometimes in the middle of the day. So, yeah.
Of people getting it nowadays, is there more men than women?
No, I have more women than men, but I have quite a few men.
Okay.
And then I did have one question. I was thinking about it earlier. Since this is more of an off-label use for the product, I know sometimes with certain insurances, they won't cover an off-label use if it's not like one of the primary usages. How have you guys been doing with reimbursement for the axonics, for the off-label, for the neurogenic bladder?
Well, all we're proving during the trial and what the insurance wants us to, and what our policy is, a 50% reduction in one of the symptoms, and then the insurance will cover it. So that's how we do that.
And so that's why we do the trial first to say, hey, even though this is an off-label use, they had XYZ improvement for this.
Still had retention.
That back.
Yeah, still had retention. Still can now go. Yes.
Okay, got it. That makes sense.
Where did Nancy go?
I know
she has some personal things that she needs to take care of in the house there. So that's where she's popping off to. But she'll pop back when she
Hey,
has
I'm
time.
back.
If
There
you
you
say her
go.
name 3 times, she comes back.
Yeah, yeah. As
Hi,
opposed
Jamie.
to click your heels together.
Um, all right. So where we at? Sorry, I keep leaving. Honestly, my son is on his way to the emergency room right now, so I've been popping on and off. So that's
Oh, sorry.
yeah,
You can go.
yeah, it's crazy. My daughter was at the emergency room yesterday, so I guess my son just wanted to do the same thing. So I will probably end up leaving here shortly, but how are you guys? Dana,
we
is
were
everything-
we're just asking a few
Jamie, unmute yourself.
Okay.
Nancy,
Yes, ma'am.
no matter how old your kids get, they're still your kids.
I know. I know. I know. Tell me, I
Mine
know.
are in their 40s and they're
Yeah.
still kids.
Yeah, they
Well, you
are.
started when you were young.
Pretty young, 22.
All right. So, does anybody have any more questions for Dana? I think I heard something about so the app has a lot of information on it, right?
I think that'll answer a lot of the questions and the misconceptions and kind of clear it up.
Okay, that's awesome.
I don't mind ever joining you guys again for follow-up after you read about it. I could be, yeah, I just thought you wanted me to talk, so I didn't even prepare any slideshows.
That's okay. I didn't say any. I
Okay.
should have said something, but I didn't either.
Okay.
So that's my bad.
Was that her?
But we'll have
Bill.
we can chat about it. And you
Oh
guys
no! Did you go to
app
Boston?
and-
Yeah, you don't
And
know if I
then,
found a room yet.
I'm gonna
And
mute
got
you.
room. I said, didn't go yet. I'm going tomorrow.
I'm gonna
She's
mute you,
still
Butch.
muted.
Excuse me.
I'm gonna mute you if you.
I know. I'll stop talking.
But yeah, we can bring you back on. That's not a problem. I really appreciate you taking the time out to chat with us about it. I will rewatch this as we recorded it. And then if I have any questions, I'll reach out as well.
Okay.
So, all right.
Thank you for having me, everybody.
Absolutely. Thanks for being here.
It's an honor. Thank you so much. Have a good evening.
You too.
Thank you. Bye-bye.
Bye bye now. So I'm looking at who is R. And who's with the iPad?
I'm on my iPad.
Me, Robert.
Oh,
That's
hi,
Oh.
Robert.
I don't know why every time I join, it says R.
Okay. All right. And I also want to let you know, Jamie Clendenning is on here. She's an awesome person. Happy to have you on, Jamie. And Annie is help me out, Annie. You're a medical student?
Yeah, hi everyone. My name is Annie. I'm a medical student at Penn State. So nice to meet you all.
So I asked if she would be she wanted to kind of learn more. So I said, hey, come on to the support group. And so here she is. So happy you're here too, Annie. Dane and Lori, glad you're here as well. And John, haven't seen you in forever. How are you?
Doing well. It's every time I get your email, I write it down and then I don't get back to my laptop or my iPad. So I forget about it and it just I just lose it from every 2 weeks. I just forget about it. So, but I was sitting here. I'm thinking, oh well, glad to be here.
So I'm thinking for the little bit that I heard about this, I need to do a little more investigating because what I was talking about, the stimulator that they use for patients with spinal cord injury, it has like a remote for bowel, bladder, and erections. And you press what you want. You got to make sure you're pressing the right button too. You know, you get an erection when you want to poop. That could be rough.
That could spoil a moment real quick.
Yeah, it could.
In the not to interrupt you, but in the my last visit with Dr. Littlejohn over at Hershey, he had suggested that I get one of these stimulators. I don't know if it's the same one she's talking about. I did run it past Dr. Romanowski, and she said that I should take a wait and see attitude with it. Just for I wasn't having any issues with voiding my bladder. I got past the catheterization part, and then I was, I was voiding on my own, and I was also defecating on my own. But he suggested I get one of these stimulators, and I thought, no, I don't need one more thing now. So, but everything's been going well.
So if everything was going, were you having issues when he suggested it? Sorry, am
I don't know. It might have been a little bit of neurogenic in there. I don't know. I didn't feel like I was having any issues. But I was seemed like I was going more frequently than I maybe should have, but that's kind of evened out now. So I don't think I really need any stimulator for that purpose. So, but I don't know. I don't know if this is the same thing or not. I came in, halfway through or whatever.
Right. I need to do a little more research on it as well. I apologize. I didn't get a chance to do it, so I can't really speak really to it, but
yeah,
I'll look more into it and we can revisit it.
I would say this one sounds a lot more usage for like overactive almost. Like it sounded, just from my understanding, that a lot of it was kind of based on you being able to feel and being able to kind of direct that care, which I know is a barrier for some of our people, is the actual feeling of it. And I don't know if it just like, I agree. I think I need to look into some of them.
Yeah. And that was my take when she said that, oh, well then, so you can initiate a void and you can feel, and I'm like, well, that's not okay. I'm confused. So I understand you all's confusion with it as well. I will do some research on it.